Kenya loses thousands of preterm babies every year, many from preventable causes. Shortages of equipment, space, and weak referral systems in public hospitals leave the smallest newborns fighting for their lives. Skin-to-skin care, commonly known as kangaroo mother care, saves lives, but most hospitals lack designated rooms for mothers to care for their fragile babies. Our health reporter, Emily Chebet, shares the stories of two mothers who each lost one twin but continue to fight for the surviving child. A powerful call for governments to invest in preterm care.
Behind these walls at Mama Margaret Uhuru Hospital in Kariobangi, Nairobi, tiny babies weighing less than a kilogram are fighting battles their bodies were never meant to face. But many of these battles are made harder not by nature, but by the gaps in the healthcare system. For Jacqueline Achieng Otieno, her third pregnancy lasted only 32 weeks.
Nililala tu, kuamka asubuhi, nikaamka nikashuka kwa kitanda, kushuka kwa kitanda, kusongesha mguu chini, maji ikatoka once. Ikajaa. Sasa ndio nikaita mume wangu nikamuuliza, na hii kama ni mkojo hii si kawaida.
She first sought care at a private hospital in Babadogo and was later referred to Mbagathi County Hospital. Until that moment, Jacqueline had no idea she was carrying twins.
Nikafika Mbagathi kitu saa 10 na dakika kama 10 hivi. Wakaniambia itabidi tukufanyie scan nyingine tena, juu maji bado hiyo wakati maji bado ilikuwa inatoka tu. So pia wakanifanyia scan wakasema watoto pia bado wako na maji ya kutosha kwa tumbo. Nisiwe na stress, wakaniambia tu niende nikae kwa nyumba.
On the 3rd of November 2025, just 2 weeks after seeking medical help, Jacqueline went into labor. Tragically, she lost one of the twins. Immaculate Akinyi, a first-time mother, shares a painfully similar journey. She delivered preterm twins at just 26 weeks, one weighing 800 grams, the other 900 grams. Sadly, only one of them survived.
Si tunaishi 5th floor. Kufika hapo 4th floor, nikasikia ni kama nataka kwenda choo. Kufika hapo, nikaenda choo vizuri, nikateremka. Kufika 3rd floor, nikasikia ni kama maji inatoka.
A preterm baby is one born before 37 completed weeks of pregnancy. While their mothers face stigma, these babies are fighting simply to survive.
Nikaambiwa niende nione mtoto nashari. Kupika pale nashari. Mimi hata nilishtuka. All my life sijaenda nashari. Mimi nasinga tu nashari. Kufika pale condition ya mtoto hata ungetamani kuona mtoto. Mtoto mwenyewe ni mdogo, vitu amewekewa pia zinakushtua.
The maximum is 16 or 18 babies at one go, because again we don't have enough capacity to handle more than that. Cots we have very few. We have only 7 cots. We have 7 incubators. We have 2 resuscitators.
Preterm babies are Kenya's leading cause of newborn deaths, accounting for 51% of all neonatal mortality. In 2019, Kenya lost thousands of preterm infants, deaths that could have been prevented with basic equipment, trained staff, and proper referral systems. Save the Children is supporting health facilities in Makadara and Kamukunji to scale up kangaroo mother care, a simple life-saving approach for premature and low birth weight babies, where a mother or caregiver holds the baby skin to skin on the chest, usually wrapped in a blanket for warmth. This skin-to-skin contact helps keep the baby warm, improves breathing, supports healthy growth, and builds a stronger bond between mother and child. But a major challenge persists. Many hospitals still lack adequate space for mothers who depend on this critical care.
We did an assessment and all the public health facilities in these 2 sub-counties didn't have any KMC units. And that meant that once a child is born, a preterm is born, or a low birth weight babies, they were forced now, the nurses and the healthcare providers were forced now to refer these babies to a different sub-county or a different hospital. And that causes also there's an implication cost, and also the quality of service is compromised.
Kangaroo mother care has helped both Jacqueline's and Immaculate surviving babies gain weight and stabilize. But without enough space, trained staff or dedicated KMC rooms, many mothers across Nairobi and other counties are forced to leave the hospital before their babies are fully stable because they cannot practice kangaroo in crowded corridors and shared wards.
Bila alifika 1.2, akatolewa kwa oxygen, nikaambiwa naweza mfanyia kangaroo. Unamweka kwa kifua, unamtolea manguo zote, pia unatoa za nini nguo, unamweka hapa kwa kifua, alafu unamfunika vizuri.
As we take care, up to 1800 and above grams is when we discharge home. We expect this mother, for the duration she's here, she has gained the experience which she will apply at home, plus the family members.
County governments are now being urged to equip newborn units with incubators, cots, oxygen systems and dedicated kangaroo mother care spaces because no mother should lose a child simply due to lack of equipment.
In Makadara, we renovated a KMC room for in Makadara Sub-County Hospital as well as Bahati, while in Kamkunji, we went to the Isli Health Center and Pumwani Majengo. So in these facilities, we renovated them and we also equipped them with the CPAP and other equipment that are able to offer, give the nurses an opportunity to offer quality care to the low birth and preterm babies.
I've only been able to train 200 CHPs, 100 from Makadara and 100 from Kamukunji. And those two sub-counties have more than 500 CHPs from each sub-county. So it will just be prudent if we can get another external partner or even the national government to provide these CHPs with the basic knowledge, and these problems can be prevented because they are in close contact with members of the community.
Beyond the medical challenges, mothers of preterm babies face deep stigma, blamed for their early labor or associated with witchcrafts or myths. Majority of them develop mental health issues while some deny their babies.
We have those champions, that a mother who has gone through that process, that they have delivered a premature baby, and they have gone through the process, they have taken care of this baby, and now the baby is big, some are already in school, they are doing well. So we bring them back to the health facility so that they talk to these mothers.
According to the healthcare providers, preterms are born too soon, but it is never too soon for the government to act and save them. Emily Chebet, Citizen TV, Nairobi.